This is Average Joe PT. We're here to reduce anxiety, improve function, and master your pain. Isn't that right, Skully?
I want to do tonight's intro.
Seriously, you want to do the rest of this?
Yes.
He wants to do the rest of this, folks. Fine, go ahead, Skully. You go ahead and shine tonight. Go ahead, you do the rest of it for him. Go right ahead. I'm waiting.
Tonight we're going to go over all types of stretching and strengthening techniques that you can do in your own home. These techniques are going to work on reducing your pain, whether it's acute or whether it's chronic. What do you think about that, Average Joe?
All right, good. All right, folks. So, Mr. Skully show today, I guess. But we're going to go over those other techniques that he talked about. And we're also going to show you some stuff that you probably wouldn't see in any other website or channel besides here. Also, if you're new to this channel, we'd love to have you subscribe down below. Hit the bell. Skully and I bring content once or twice a week. We do lives on Wednesday at 6:30 Eastern Standard Time. So we want you to buckle up, hold on, here we go. During the live, Skully and I, we talked about good old hip pain, where it's coming from, what kinds of problems you can have. We talked about osteoarthritis, we talked about snapping hip, talked about total hip replacements, talked about piriformis, and we ended a little bit of the SI joint. We want to talk about the SI joint and different mobilization. I'm going to talk about that next week, Wednesday, 6:30. That'll be the live. Hip and hip treatments is what we're going to do right now. We're going to get into the skinny. Treatment number one, when you're having that pain along the side of that hip, that good old ball pain coming down the side of the shaft of that leg, we want to go ahead and do number one. You're going to take some Leuko tape, comes with the white cover roll and also comes with the brown roll. You're going to want both. Don't just put the brown tape on the thigh. It'll be way too hard to take off and it might actually tear your skin. You're going to cut a nice length piece of tape. Take it off. Has two covers on it, two sides. I make this look easy because I've been doing this forever. Kind of like saran wrap. If this thing bunches on each other, it's impossible to get it back off. Now, what you're going to do, you're going to take that right down almost at the knee, and you're going to come up into one side, and then you're going to have another piece on the other side, and then you're going to take the tape, the brown tape, right over the top of the white, and you're going to give it a nice little snug so that tissue comes into a shortened position, and then you're going to lay it down, and you're going to do that to the other side, right along this side here, almost like the letter V or Y, and then you might want to put a strip right between the V or the Y. Wear that for 2 days, shower with it, take it off on the second day. If it gets itchy or scratchy, take it off immediately. When you do take it off, make sure you heat it up pretty good so that the glue is nice and soft and it pulls off easy. Word to the wise, if your skin's very fragile to begin with, don't put this on. You'll probably cause a skin tear. But that'll really help the lateral side, the IT band, the muscle that attaches right along the side here and along the top of the hip here. It can really help that kind of pain and just give it a little bit of period to rest. You can use that for a couple days, take it off. You might need a day or so for the skin to recover and then reapply. It's a really nice product, pretty simple. I'll leave a link down below for that Leuko tape. It's probably like $5 or $10 on Amazon. It doesn't cost that much. Comes in a big roll. I do it on all my different videos for different problems. If you see my other videos, the elbow, the shoulder, we can use that taping and that techniques for other parts of our body. Buy a roll, keep it, because if you have another problem down the road, or if you want to see some of my other videos that shows that tape, different types of taping technique, you can go ahead and use it for that. That's technique number one. Technique number two, I'm always in love with. They're not sponsoring me at all. The Lidocaine patches are wonderful. Now, I am privy to the Icy Hot. For some reason, I like it better. It's fairly expensive. It's like, it lasts 12 hours. It's like 8 or 12 bucks. And I think there's 4 or 5 that comes in a box. You just peel off, or actually you snap and peel off the two ends. And I would put right along the side, maybe in the front. If you're having most of your pain along the side, or what we call the greater tuberosity, this little bone right here, And there's a little bursa in that area, so you can have hip precise in that area too. This is a nice little treatment that you can do for that. Third treatment you want to do for that, attend you. Transcutaneous electric nerve stimulator. That's right, TENS. You can get the one I've shown. This is a TENS 7000. You can pick this thing up for probably 15 or 20 bucks at the most. Really nice, it's small. All you're gonna do is you take the 4 pads, you're gonna place them literally right, 1, 2, 3, 4. You're gonna surround your pain. Plug it in. I would put it on what we call the modulation mode. That's a nice little mode to kind of the pain that vibrates in and vibrates out. You shouldn't be turning this unit up to where it's causing a muscle contraction. You got it too high. The closer the pads are together, the more intense it'll be in one spot and the more superficial it'll be. The further the 4 pads are apart, that means that electricity is diffused across the larger area. It's gonna go in deeper and you'll have to turn it up a lot more. So be mindful. There's a lot of fragile areas around here, so just kind of keep it around that nice little pocket, that little zone where you're having most of the pain to begin with. You want to wear it for probably 20 to 30 minutes. There's no really contraindication for it unless obviously you have a pacemaker or you have active cancer or bleeding in the area. You wouldn't put that there anyway. But those are the really only limitations. You're not supposed to sleep with it because obviously if the one pad peels off and peels back on, the current will shut off, and then all of a sudden if the pad goes back on, you're going to get a quick zap. The units are pretty safe nowadays. Mine is you can program it for 30 minutes or 60 minutes and it'll shut off. So that's the basic 7000 series. If you want more information on that, you can go ahead and leave comments down below and I'll go ahead and answer those for you. That's the 3 techniques when it comes to reducing pain. Now we're going to go into what you see all over the internet when it comes to maybe stretching or strengthening. My premise as a physical therapist, my thoughts are reduce the pain first, then go into gentle stretching, and then if you can recover enough, then go into strengthening. You can't strengthen something if there's a lot of pain there to begin with. You're going to cause more inflammation, you're going to cause more pain if you try and push yourself by strengthening first. So we got to reduce the pain with these types of things I'm talking about at home, then go into stretching, then go into strengthening. Now, stretch number 1 is pretty simple. It's just either a standing lunge or a half kneel lunge. So the standing lunge looks like this. Let's say we're going to go ahead and stretch this right hip out. All you're going to do is make a nice wide stance. And all you're going to do is come on down, come forward, stay up nice and tall. You don't want to tilt forwards. You kind of lean into, you get a nice little pull in the front of that hip. You hold for 30 seconds to a minute, and then you rest and come back up. If your legs can't take that pressure for that long, you have a table, you have a chair in front of you. Be smart, be safe. Always make sure that you're not at a high risk of fall when you do this stretch. The second one you can do, you come down into a kneeling position, and you can do the exact same thing. Just make sure that you are not coming forward. Stay up nice and tall and that your front of your hips coming forward. You should just feel a pull in the front. Don't go into the pain. Go into the stretch, excuse me. Go to the point where you initially feel the stretch, then you stop, and that's where you hold. 30 seconds to a minute. The second one you can do if you want to, it's called the piriformis stretch. Now I'm going to move good old spiny over here. Now I like to do this one. You can do this one in sitting if you want. We're going to do the right leg again. Come up nice and tall and just pull that knee towards the opposite shoulder. So the right knee comes to the opposite, so to the left side, kind of an angle, what we call an oblique, or kind of just a simple diagonal angle. So you hold that for 30 seconds to a minute and relax. Now you can do it in this position, or you can do it lying down and do the exact same thing. 30 seconds to a minute, you should go to the point where you feel a stretch, no pain. Pretty simple, ain't that right, Skully?
Oh, you're gonna let me talk now?
Well, you had the whole first part of the show. I wasn't gonna let you talk to the entire thing. I mean, how much time do you want on this? It's supposed to be the Average Joe show. It's not called the Skully show. Boy, I tell you, he is ridiculous. He wants all the time. You know, how am I gonna show everybody stuff if you just really, now you're gonna go ahead and start that nonsense. You light yourself up now, next just to show off.
What can I say? I'm mad at you.
Something else. He just, it drives me nuts. He says I drive him nuts. I think he drives me more nuts. Those are the basic techniques for pain management and stretching. Strengthening exercises you can do. You can do them simply and standing. You're standing nice and tall and just coming out to the side. Nice little pause, up nice and tall. You don't want to drop down. You keep your fanny tucked in. The same thing going back. Do the exact same thing. 15, 20 times. Now you can go crazy and put a rubber band around your ankles and do the exact same thing. I've shown those rubber bands before. I'll go ahead and I'll leave a tag down below so you guys can go ahead and look up. You can get probably a bunch of that, whatever color that you want. I'd start out at the least resistance for probably, I don't know, $4 or $5. It's pretty cheap. And I'll leave a link for the TENS unit and the tape and the Lidocaine stuff too. So you guys can go ahead and just click on that and you can go ahead and go to it. Like I always say, if you have any comments, no dumb questions, all right? You don't ask it, I don't know. So go ahead and leave a comment down below if you want anything in regards to your hip problem or whatever I talked about today. Isn't that right, Skully? No, he's not gonna talk. Mum's the word, huh, Skully? Mum's the word up there. Like Skully and I always say, we want you to look up and keep smiling. You gonna say anything?
To all my subscribers out there, look up,
That's
keep
right.
smiling.
Thank you for at least participating at the end. He's something else. All right, folks. See you next time.